Hello everybody, I'm Dr. Ankesh Saithya, a gynecologist practicing in Andheri West, Lokhandwala. The topic which I want to discuss today was something I have been seeing very frequently over the summer and the monsoon months in Mumbai. Since we only have two weathers, warm and warmer, this leads to a lot of bacterial infection in the urinary area causing UTI, which is called urinary tract infection. Now, why is this more common in women? Primarily, we see young girls from the age of 16 up to women of 65 years old getting regular UTI. Now, what is UTI? The regular host defense mechanism of the urinary bladder allows urine to be flushed out of the kidneys via the ureters into the bladder out via the urethra. They don't allow any adherence of any bacteria or any other organisms to these areas because of regular passage of urine. When there's less passage of urine, organisms are prone to develop in higher amount. Now, why is this condition more important in women? The shorter urethra, proximity of the urethra to the rectum, these conditions cause higher rate of ascending infections up to the very sensitive urethra. Now, very often we see elderly women with the same symptoms because they have neuropathic symptoms and may have kidney stones. Even this leads to urinary stagnation and infection causing severe UTI. Younger women who are sexually active, unprotected intercourse, multiple partners, the use of lubricants, frequent hospital admission, urinary bladder catheterization will also cause certain symptoms of UTI. Now, how does one diagnose UTI? When you look at the general condition of the patient's she's feeling a little, down, low. There's something called as malaise. The malaise is primarily the feeling of being unwell, loss of appetite, mild fever. The main striking symptom is burning and pain, like a stinging sensation while passing urine. Some patients give complaint of fever with chills, shivering. Some also have a high pulse rate, tachycardia. Some might have lower abdominal pain, and in some severe cases, there might be pain leading from the back to the front, from the loin to the groin pain. The ideal investigation to do for such a patient is the urine culture. A first episode of urinary tract infection, urine culture, will help us get the ideal antibiotic required depending on the pathogen causing the infection. Some doctors do a urine routine at first, which also gives you the high number of pus cells, after which you can give a broad spectrum antibiotic, which will help her take care of the symptoms in the same way. Now, what are the primary symptoms a woman complains of? Like I said, burning and pain while passing urine, suprapubic loin pain. If a patient has these symptoms for more than 3 episodes in a year, she is labeled as recurrent UTI. This is caused by various notorious organisms like E. coli, Proteus, Klebsiella, Enterococci. These are all bowel pathogens and urinary pathogens. The patient typically has symptoms of frequency, which is passage of urine very frequently every 20 minutes. She has urgency. She can't hold and control her urine. She has to rush to the urinary segment of the washroom and empty her bladder. She has vaginal discharge, could be concurrent vaginal infection. She might have pyuria. She might see pus or hematuria, blood in the urine, and with or without mild flank pain. Now, what is the solution to this? The woman needs to be explained that she has to have plenty of oral fluids. In mild to moderate cases, oral fluids will work. Severe cases with frank blood, frank hematuria might even require IV fluids. A good antibiotic and a painkiller. Typically, we give a drug called as levoxate, which is available as Urispas, Flavospas, Urikind, various brands in the market. That will help in creating the urinary area from relief of pain and also causing relief while passing urine. Secondly, these patients might have fever. They might even require a painkiller or an antipyretic via paracetamol by the IV or the oral route. The patient needs to be explained that she has to have minimum 3 liters of water a day. She has to have adequate perineal hygiene. The patients need to understand that this condition is self-resolving only if proper precautions are taken. If you liked our video, please hit the like button. If you want to learn more, please read the link described below regarding UTI and the treatment of recurrent UTI and prevention of urinary tract infection. And if you like the video, hit the like button. Please subscribe to our channel and leave a comment in the comment box. Thank you.